But it is February, and among other things that we are talking about this month, it's American Heart Month, and we're continuing our weekly conversations with doctors from Rochester Regional Health about how you can take care of your heart, what kinds of treatment options you have here in Rochester.
Yeah, and we are joining right now by Dr. Depta, a cardiologist at the Sands-Constellation Heart Institute, and you brought some really cool things to show us, a lot of neat things that are going on that you guys are doing.
Absolutely. So I'm an interventional cardiologist at Rochester Regional. And specifically specialize in something called structural heart disease. And
I wanted to ask you, when you say interventionalist.
Yes. So that means we have non-surgical ways of fixing the heart through catheters, which are really just long tubes that we insert either through the wrist, the groin, or other ways to be able to fix the heart without having to do surgery from that standpoint. And in structural heart disease really means that anything either acquired or people are born with, holes in the heart, valve issues, things that we are able to fix without surgery, which is very cool.
Come a long way.
It is. So we have some models that I wanted to show you. For example, people who have one of the most common valve conditions called aortic valve disease. People will be out of breath, they might pass out, they get chest pain. We're now able to replace the heart valve by going through the groin. People stay overnight in the hospital, leave within 1 to 2 days. There's no incision. It's really remarkable that we're able to do this. There's also, and here's a valve here if you guys want to see.
Yeah.
Right, you guys can see that.
That is crazy.
Wow.
No open heart surgery.
No open heart surgery.
Wow.
It takes less than an hour to do.
And the
we can
recovery...
we can do it with conscious sedation. We don't have to put people to sleep for it. It's really remarkable.
And the recovery time after a procedure?
Time, 1 to 2 days in the hospital. People are on their feet by the time they go home. So.
And what was it before?
So,
I mean, you'd have to go in for a full operation, and the recovery time is
people
long.
would have to have full open heart surgery. But this procedure is now available for about half the people that would undergo surgery. From that standpoint, it's a commonly performed procedure. We do anywhere from 5 to 7 per week at Rochester Regional. So.
I was going to ask, what's it like to be a part of such innovation here in our own backyard, where you're able to make a difference for people, and there's not that long recovery time, and it is making a difference on their health too for the long term.
I think it's really exciting. I never thought when I was in medical school that I'd be doing some of these amazing procedures. In fact, they weren't even available at the time. And they really have come to fruition in the last 3 to 5 years. This type of strategy to repair the heart is going to expand to all the valves and to all the structures within the heart. And I think this is just a preview of what's to come, that we are going to be able to deliver really effective ways to treat the heart that don't involve surgery.
And you brought another example for us of something else you guys got going on.
So this is something called the Watchman Device. This is very cool. So people who have atrial fibrillation, they're at a very high risk of stroke. Typically, you put them on blood thinners. Blood thinners are great, but they can also cause bleeding. And there's a lot of people who can't be on blood thinners, so then they're at a very high risk of stroke. There's an area of the heart called the left atrial appendage where the majority of stroke comes from. And what we are able to do is put this device here, which I'll give to you guys. It's called the Watchman Device, where we actually put a plug essentially to occlude that area so that clot can't form in it, and protect people who can't be on blood thinners. This procedure, people go home the same day. And again, it's another example of an advance in medicine for people who can't be on blood thinners, which is a lot of people.
Yeah. Important for people to know their options, what options are available to them. So thank you for those reminders. Any quick takeaways you want people to maybe take away from this segment, or in general just to learning about heart health this month?
I think the most important thing, and especially older individuals, if you're not feeling well, if you're feeling tired, if you're feeling fatigued, often people will say, I'm just feeling like I'm slowing down. Sometimes there actually can be an issue, and it's important to address that with your primary care doctor, or if you have a cardiologist from that standpoint, because a lot of times there can be something going on with the heart that we don't know, so you need to have that investigated.
All right, Dr. Depta, thank you so much for stopping by.
You're very welcome.
All right, today will be a